welcome to you, and to remind you, just your team, you know about Dr. John Higginbottom, who really started off this platform to help us engage with evidence-based and evidence-informed practices, to support people with lived experience, to support people delivering services, and in general the mental health practice field around really engaging in recovery-oriented practices, and PSR being the tools to enable recovery for people. So that's your team. So you'll see myself, Regina, Manny, Jen, and Jordan, who's our technical whiz. That's your team. And we just mentioned that this organization was initially funded by the Ministry of Health, and at this point, we have some good news about funding, and we'll tell you that in a little bit of a moment. But as I mentioned, just transferring evidence-based knowledge, providing expert clinician consultation, training and education webinars, our website resources, and supporting the advisory committee and the community of PSR practice in general, and hopefully that's you. So that's really what our mission is about. We do, before we go any further, want to just acknowledge, as staff people, we wish to acknowledge the Coquitlam and Kikwa First Nations, as well as all Coast Salish peoples, on whose traditional and unceded territory we live, learn, play, and work. And please remember that we have transitioned to a new email platform, and Jen will just provide the link in the chat box. But please, we really need your permissions to continue our relationship with you. Thank you, Jen. And if you haven't heard from us, please, a reminder to just check your promotions or your bulk folders from time to time, just so you can see some emails from us, and then formally sign up. So we can't do this work without your help, so we really need you to come play with us. So thanks very much for doing that. Also, another way to play with us is to just give us some feedback. I think in our last session we just had one person give us some feedback, so it's really hard to know if we're meeting your needs without just getting that feedback from us. So we honestly look at all that information and we take it to heart. So hearing from you really helps us be the best we can be. So yeah, and also PSR Canada would like to hear from you, so we ask you to please stay in communication with Psychosocial Rehabilitation Canada, because they too really want to try and help serve your needs, your education needs, and your support needs as a clinician, as a family member, as a loved one, whatever that might be. So just really need to hear from you as well. And you may know that that our funding was due to run out in August. What we did learn 2 days ago is that we have some bridge funding from Douglas College. We are eternally grateful to Douglas College for keeping us alive, if you will. But that just really means that if you have services, if you wish to do some presentations, please let Manny or Jen or myself know. Please just let us know, and we would love to support your participation. If you know of other speakers that maybe you've heard on a recent conference and you think we should go connect with them, do let us know that as well. So do just stay in contact with us, because we want to keep this meaningful for you. So the more we hear from you, the better. And thanks, Jen, has just given us some resources there. I appreciate that. Thank you. So without further ado, it is my great pleasure to introduce to you Cinnamon Rain, who's here sitting beside me. Cinnamon has a Master's of Public Health with a focus on social inequities and health from SFU, and a Bachelor's of Therapeutic Recreation from Douglas College. Really nice to see an alumni come back and be with us today, so thanks for that. She has most recently worked as a community research associate on projects focusing on wellness for and with people with substance use experience. Her advocacy interests include promoting mental health and wellness, social equity, and addressing the determinants of health for everyone. She herself includes playing outside as part of her major wellness toolbox as well, so thank you for that. We did also want to acknowledge that Todd Leader is lined up, as Jen says, here on the 27th. And also we had a note from Hazel in Victoria to just let us know about an upcoming session as well. She just wanted to let us know about a mini peer support conference on Friday, May 25th 10:30 to 1 p.m. In Trent Street over in Victoria. And it sounds like a really exciting opportunity for people. It's free, which is always really nice as well. And they say they welcome partners, service providers, Ireland Health staff, and anyone who's interested in peer support. So it's really an opportunity for question and answers and opportunity to learn a little bit more about peer support in the Victoria area. So they're hoping to see you there as well. So I think we're ready to pass it over to Cinnamon. So we'll just take a little moment to do that transition. Thanks, Jen, for all that additional information. I appreciate that. And then with no further ado, as they say, I'm going to start the camera here with Cinnamon, and off we go.
Wonderful. Good morning, everyone. It's so nice to see so many people in the room. I appreciate it. It's the Friday before a long weekend, so that's fantastic. This is obviously an important topic for us all, supporting the health and wellness of people who use drugs. As I say on the first slide, I'm not an expert. I'm a community person. I do have some experience in my mental health promotion background and advocacy, as well as in my therapeutic recreation focus. So last year, I presented for my master's project this topic. It's for a partial completion, and I just wanted to let everyone know it was April 13th, 2017, which was a big day for people who use drugs in the community, because it was the day that the federal government announced that they were going to legalize marijuana use for recreational use. So that reminds me that that day was the day that I presented my master's project. So welcome. What I'm going to do is throughout is ask you questions, and please just type in during the chat box. That would be great. And all the way through, I want you to think about how can PSR better support people who use drugs. So I'm just trying to figure out how I'm changing the slides. What I'm going to be talking about is a brief background of why it's important right now. My methodology that I used, it's going to be fairly in brief. I know a lot of folks might not appreciate academic methodology, so I'll take it in brief. And then I'm going to discuss some of the barriers to improving health, social well-being, and quality of life, as well as the promoters. And that's what we're all here for, I think, is to find out what interventions, services, supports, and the type of environments that help support health and wellness, as well as how PSR principles, values, and competencies actually align with some of the importance and the interventions that do promote health and wellness. And I want to encapsulate that all in an anti-oppressive framework, because we live within structural inequities, and so focusing on anti-oppressive work is really important for myself. And then I'm going to have some policy recommendations, and this is very similar to what I presented last year. There's going to be some things, as you will see in the background. There's been several population level health emergencies in BC since the mid-1990s. And the first one was the epidemic with HIV. And that really forced people to come out and say, people who use drugs, we need to focus on their health and wellness. And the most recent, well, I guess it's 2 years past now, was the BC Provincial Health Officer was a response to the rise in fatal overdoses from opioid use, and that was 2016. And we're approaching, in March 2018, they saw the rise in the overdose to 161, and they attribute 80% of that to, they call it poisoning of fentanyl. So that's an additive. That's not what people intend to use when they're actually taking these drugs. So that's some of the background, and that's why it's important today to focus on. And we want to go beyond that and focus on health and wellness. So some of the terminology that I actually use throughout was really important for me to analyze how I was talking and speaking about folks, right? And so we define people who use any illicit drug or illicit drug other than medically intended. I excluded marijuana because we had heard that it was going to be legalized for recreation use, and alcohol is also legal. So I didn't use that in my inquiry. However, there's some overall premises that I have as a researcher, as a community member, that is using evidence-based knowledge. So the evidence shows that individuals who use drugs, abstinence may not be possible for some. And they've actually been discussing that for most folks, there's a cycle of using and not using throughout a lifetime. So I really wanted to reflect that in what I wanted to do throughout the project and the research. And so I anticipated the outcome goals then should reflect an improvement of health and social well-being and quality of life. And that's all encompassing, that's health and wellness. So rather than not using or abstinence. And that's fairly a little bit more realistic. And also recovery is defined how engaged a person who uses drugs is in their own health, social well-being, quality of life outcomes. And engagement success is always determined by the person themselves. And I wanted to make sure that that was the premise as I was going into the analysis and the research. And please feel free to type in if you have different definitions of what recovery is for you or your team. That would be great as well. Share the knowledge. That's completely what I believe. So let's briefly, I'll go into the methodology. I used something that was called a rapid assessment and response. And the World Health Organization came out and started that in 1998. It was pretty amazing. I liked it because it's really sensitive to the social and political realities of communities. Especially for marginalized populations, and that definitely includes people who use drugs. It gave me assessment tools to use so I could use certain criteria from these assessment tools that the WHO came to gather my information, what's important. And it's amazing to have such a large team like the WHO because they have experts. They already tell you what's important. And so you just adapt it to your own context. So the assessments was the contextual analysis that was looking at what's happening socially, politically, and economically in British Columbia. And the drug use assessment, so what sort of drugs are being used and how are the drugs being used? The health consequence assessment, which is more, I used the physical, mental, and social, which is social is huge because of the stigma, discrimination, and marginalization. And that's a huge health consequence. And risk behavior assessment. And then I went into looking at what type of interventions are important in the British Columbia context, like health promotion and treatment and primary care. And then the policy assessment, which is, I went and looked at drug policy, harm reduction policy, health policy, and how that intersected, especially over the last 10 years. And that's changed tremendously. But that's the brief overview. And here's a sort of visual of what was happening. The assessments, document gathering, analyzing, critical analysis, and then going back to see what I was missing. And what I found is that I sometimes was missing some of the user groups. So I had to go and find research that was actually based from, a lot of the times it was based from Bandu, that's a local user group, and WARS. And they have a lot of information and a lot of research has been put out in the last 10 years. So that was really helpful. And so I really wanted to make their voice central, and so I didn't want to miss that. So there we go. So we need to definitions, and I wanted to make the definitions that I use very inclusive. So as we've probably seen or heard a lot of what health is. So it's a state of complete physical, mental, and social well-being, not merely an absence of disease or infirmity. I went further in the actual paragraph. It goes, the enjoyment of the highest attainable standard of health is one of fundamental rights of every human being, without distinction of race, religion, political belief, economic, or social condition. And I really wanted to make that a focus, especially when we're talking about people who use drugs, because the social condition here in the context in British Columbia is sometimes will overweigh anything else. And the second was the social well-being. And this, it was adapted from a variety of sources. So, and I wanted to make it fairly inclusive. It includes having social support and a valued social function while being able to participate in the social, economic, and political structures. Quality of life reflects a general sense of happiness and satisfaction. And life, it encompasses all aspects of life, including health, recreation, culture, values, and all of the conditions that support of life like that. So I really appreciated that, and I found that the most all-encompassing definition, and I tried to use that throughout my analysis and my focus when I was looking for interventions, that they needed to meet these criteria. And I call this just health and wellness. So an overview of the existing interventions most relevant to people who use drugs, and a lot of you probably maybe work in fields that have this: health promotion, the process of enabling people to increase control and improve their lives. And sometimes it focuses on making healthy choices, and that can be debatable, as we know. I'm sure that the language could be changed. Prevention, primary care, and addiction medicine, and treatment. So I combine primary care and addiction medicine. A lot of folks might not be familiar with addiction medicine, but it's being able to provide primary care, but understanding all of the social, political, and economic and specific needs of people who use drugs. And harm reduction interventions are really important, especially in the British Columbia context. And harm reduction isn't just the drug consumption facilities or Insight, as we know locally, or the overdose prevention sites. It's all focusing on the human rights, focusing on reducing harm in all aspects of people's lives, and making sure that there's maximal intervention options. Prioritizing goals, which means having drug user involvement and making their goals the priority. And there's just some example of other things that we see as harm reduction. And I added in green because I didn't have this last year, the overdose prevention sites or the drug testing availability, because this last year they've really opened up because they've changed the laws, which is really helpful. Some other things that are really equally as important is the additional health care and social care services, and that's specialized health services specifically for people who use drugs. And that's mental health and HIV services, and gender specific. I know BC Women's Hospital and Oak Tree Clinic is really doing amazing things focusing on gender and health. So there's housing and food security, legal service and advocacy. I think that's really important because of the legality of drug use, and we see that. It's still not all public health. It still has some legal services required, and that might go together with housing as well, because of people being discriminated against because of housing and not being allowed there. So income and employment and rehabilitation services, that's so important and relevant. And I define that as supports and care given to form and knowledge, training, and skills to support people to achieve optimal level of social, physical, emotional, mental, cognitive, and spiritual functioning, civic and community participation. And some examples are definitely supported employment, supported education, life skills training if necessary, and of course, as being trained as a rec therapist, leisure and recreation, very important. So the next thing I have is, if everyone can get ready and think about, what do you think are some of the barriers to improving health, social well-being, and quality of life for people who use drugs? Not too sure. I'll give you a minute and just some ideas. Danny says establishing trust and rapport. Christine is the amount of people receive. Oh, when on social assistance is a barrier. Yeah, so income. Stigma. Thank you. Oh, Katie, drug-free policies and social community service buildings. Lack of local services and transportation barriers, definitely, especially we're finding that in the more of the rural communities. That's extremely barriers. Wow, stigma from the gatekeeper. Yep, services prior to getting into desired program. Oh, lack of affordable housing and adequate housing to meet your needs. Thank you very much, everyone. That's wonderful. So you have mostly what I have found. So, like I said, I wasn't all the expert. So what I found is a lot of the barriers was those drug laws and enforcement actions over the last 10 years. So, and if you fear arrest, you are more likely not to access the needed services. You're more likely to use a loan and share drug equipment, which they've really seen, depending on the location and the actual enforcement action, that HIV and hepatitis C rates went up because people were sharing their drug use equipment. So definitely. So lack of integration of services. I know a couple folks mentioned that. Lack of coordination of services. Insufficient of continuum of care. And this results in having folks go to one service appointment to another. And we see that so often that you get exhausted if you're always going from appointment to appointment and you're still trying to get those basic needs and, you know, and affordable housing, as we discussed. So people might be vulnerably housed. Okay, we know that having consistency with service providers is important to build trust and rapport, as mentioned. So that's pretty awesome. And then we have the big barriers, like I know some of you also mentioned: stigma, discrimination, marginalization, and it results in folks not seeking services or being re-traumatized. Like one person had mentioned there that when you go to a service, they might actually have barriers and saying you can't be using. And so you're not going to be seeking that service. So exclusion from social, economic, and political participation because of the stigma and discrimination. And we say that's exclusion from civic and community involvement. All of this adds to social isolation, increased mental health, people not accessing the much needed health and wellness services that we actually have to offer. And these are huge barriers. So we're here in my iterative process, and I just wanted to show that. I like showing off my methodology process. Might not talk about it, but I like showing it. And so next is the questions. What types of services, supports, and environments are needed to improve the health, social well-being, and survival need issues for people here? So I'm asking you to do more work, I know, on a Friday morning, so I appreciate that. So what are some of the things that you think improve health? Oh, access to a psychologist and clinical counselors outside of the current mental health system. Yeah, if we are looking at trauma-informed and resiliency-based support, then access to individual therapeutic support. Yep, amazing. And Christine says secondary distribution sites, community health centers, harm reduction philosophy, non-judgmental, open, honest communication. Wonderful, yeah. You guys are having great ideas, see? Okay, perfect. So let's sort of what I found. And this was last year too. I found that the important intervention services and supports beyond emergency healthcare crisis. Because we have to remember that when people are in emergency crisis, it's an immediate issue, and that needs to be cared for all folks. So housing supports, number one. We know that housing first works. It's an evidence-based philosophy. So having a safe place to sleep, for sure. Harm reduction interventions, that was very well placed. And that includes access to a full range of drug treatments as well, and not just the consumption sites, but having options available for treatment. Income and supported employment when available, and I say when available because there's huge stigma about employing people who use drugs, and having the supports there necessary, because we need to make sure that we adapt for and meet all folks' needs, and then that helps all of us in the long run. So additional rehabilitation services, those are huge promoters. As well as I found additional, like we were talking about, the environments. And these are overarching characteristics that must be in all of those interventions, that, you know, the housing as well as the additional rehabilitation supports and harm reduction. They called it an enabling environment, and I actually had to do some research when I found this in all the evidence in the literature. And the best definition I found was an environment that allows for access to information, knowledge, life skills, self-determination, and opportunities that supports a person to achieve optimal health, social well-being, and quality of life. And that's, for example, we have to have those laws and policies changed, like to have consumption facilities, so in all communities, and then we have to have the enforcement of laws to make sure that no people aren't going to be arrested when they go into them. So, and then we have to have a community with additional supports like consumption sites with counseling, and I know that they do that, so that's pretty amazing. So all of those things need to be in place to have an enabling environment. And then, of course, I always put the housing first models, because those are pretty important, that safe place to live, and we have a lot of concerns with that now. So, and somebody said trauma-informed and person-centered. So integrated person-centered care, and that's integrating all of the primary care, the addiction medicine, social care services, and that's income and supported housing with the harm reduction spectrum, full access to treatment, like I mentioned, from abstinence-based to prescription, whatever that the person requires, as the continuum of care, and with rehabilitation supports. So to that, and so I really like the trauma-informed as an aspect of being person-centered. Evidence points to the need for a solid commitment when we have care supports and services for people who use drugs, to make sure that it's person-centered and trauma-informed. And I got this from Nancy Poole and Lorraine Greaves. This definition is trauma-informed means emotional, physical, and cultural safety, choice, autonomy, and social inclusion and participation, resulting in people who use drugs being treated with dignity, respect, and where the individual determines their level of involvement in any service or support. And I think that that's all fairly all-encompassing. And I just wanted to mention the new resource out there. I got it last Thursday when I was updating some of these slides, is the BC Centre of Excellence for Women's Health have a new trauma-informed practice and the opioid crisis. And it's pretty all-encompassing, and it's a discussion guide for healthcare and social service providers. So you might want to take a look at that. And I know Nancy Poole is one of the authors as well. So from 2007 to 2018, she's still at it. Yeah. So it's wonderful. So, and the third is equity to prevent inequities. I know that sounds a little strange, but I focus on social inequities. So inequities is really important. So inequities are health and wellness disparities that are unnecessary, unfair, and preventable, resulting from social injustices that become entrenched in societal norms through its social, economic, or political structures. And I'll give you an example of an inequity for somebody who was using drugs many years ago, and this is how I first got interested, is that they couldn't receive certain mental health treatment unless they were also seeking abstinence-based treatment, which that was not an option for this individual. So this individual struggled with mental health for many years until he found another service provider that didn't have that exclusion. So that's really important. So that means that supports are available, accessible, and acceptable. So I got this from the World Health Organization as response, and that's geographically available. So we need them in the urban centers as well as our rural and smaller communities. Accessibility, so low cost, no cost, transportation, childcare, and acceptable and appropriate. And that's sort of user-friendly, like non-stigmatizing. And that's always defined by the person receiving treatment. And I think that was really crucial when I was doing my evidence, that if you don't have the person defining if the service is appropriate, you might not have an appropriate service. So person receiving services need to be the gatekeeper then. So let's go on. How does PSR help? Let's start this. Okay, ways in which the core principles, values, as well as the competencies of PSR in align with interventions that improve health, social well-being, quality of life for people who use drugs. And this is really important. And this is, I really had to go and think through. And I want each one of you to, if you know some of the values and principles and competencies, to think which one you would use to fit certain ones. But here's what I thought through for the enabling environments. The environment that allows for access of all of those. So PSR principles and values that really hit home and attribute to that is PSR practitioners convey hope and respect and believe that all individuals have the capacity for learning and growing. And I think that's definitely an enabling environment aspect. PSR practitioners engage in the process of informed and shared decision making and facilitate partnerships with other persons identified by the individual receiving service and supports. That's really important, having that social support network. And the PSR Competencies understands the needs of people with mental health, including complex cognitive, behavioral, substance use, and physical challenges, who are best served by psychosocial rehabilitation services, and understands the effects of stigma and discrimination. Huge. That's so important when we're talking about services and supports and quality of life for people who use drugs. So integrated person-centered care. I think of everything, definitely PSR is person-centered and is designed to address the distinct needs of individuals consistent with their values, hopes, and aspirations. Psychosocial rehab services and supports must be readily accessible to all individuals whenever they need them. These services and supports should be well coordinated and integrated as needed. So the competencies apply trauma-informed practice, guidelines, and approaches, health education regarding problems associated with mental illness and problematic substance use, demonstrates knowledge of interventions for trauma. So please think of other ones that you yourself use that'll fit. Equity. So psychosocial rehab practices support full integration of people in recovery into their communities, where they can exercise their rights of citizenship, accept the responsibilities, and explore the opportunities that come with being a member of that community and larger society. And that's that civic and community participation. And I put this one in there as well because equity is also diversity. And it's recognizing that culture and diversity are essential to recovery and strive to ensure that all services and supports are culturally relevant to the individuals receiving services. PSR practitioners strive to help individuals improve quality of all aspects of their lives: social, occupational, educational, residential, intellectual, spiritual, and financial, and demonstrates knowledge of culture and diversity, the competency. And I put all of the domain D under the competencies, which all encompasses equity and social participation. I think those are really important. So if you want to go and check out some of the competencies and see yourself which apply, that would be great. And so now we're here to my methodology and my processes. And what I really thought was important is, since we're dealing with structural inequities and people who use drugs, basically, we need to find what framework actually works best to address some of the inequities that we're facing. So, anti-oppressive framework. And I know I have understanding, worldview framework. Well, I called it last year Antioppressive Framework. And I had a lot of folks and a lot of discussions saying, no, it's an understanding. No, it's a worldview. And all of those are equally just. So I put them all up there just in case my friends that we had a discussion with were coming on today. And because I wanted to be all inclusive. So you decide if you want to call it a framework, an understanding, or a worldview. As long as it's used, that's what I always tell them, as long as it's used and we understand it. And so it addresses the structural inequities of oppressions. And that's inflicted by all the power systems and power and privilege, including colonization, discrimination, all the isms I always say: classism, sexism, ableism, saneism, and then patriarchy and heteronormativity. It's really, we need to all encompass all of our services and supports and have a discussion Do they address all of these oppressions? And if so, how? There's three aspects to the anti-oppressive framework that I always like to use, and that's knowledge, relational, which is the power relationships, and the social justice. So let's go through. Here's another visual, because I like things and not just in words. I like visuals, so that's what it is. So our anti-oppressive understanding, worldview, or framework. Okay, the first one is knowledge, is understanding that knowledge is socially constructed, politically shaped by the dominant group, and can be changed. And this is definitely something with people who use drugs with and for, right, that can be changed. So we need to make sure that we include them in all of the conversations when we're talking about understanding, and that's in our institutions. That's where we get most of our knowledge from, is specifically our academic institutions and training of practitioners. So relational is understanding that relationships are power-based and create social exclusion and marginalization. And like I always say, between the provider and the person receiving services, it is always a power base, but how can we actually make it where we're walking together? We're walking side by side. And there's always relationships between the funding organization and the community organizations providing services. And these can be shifted. So often community organizations have to and are mandated to do certain things to get funds. So we need to have that power, more of a balance. And how do we do that? Let's have that discussion. This is all about creating space for discussion for later on. And social justice, and I always say it must be attempted, so we must have action. So this entails challenging the dominant ideas about who people who use drugs are and what they need. And so often we hear in the media experts, and that's why I say I'm not an expert, saying what people need, and so we need to hear from the folks with lived experience. So how I see is PSR, all of their values and principles and competencies. PSR promotes enabling person-centered, equitable environments, thus promotes participation of people who use drugs in community and civic participation, and promotes reducing all the barriers to social, economic, and political involvement, which reduce stigma, marginalization, and structural inequities. And so all-encompassing PSR is a philosophy and a framework that I use to make sure I'm doing what's right, as they say, in a good way. So this begins with the use of anti-stigma language. And let us have a conversation, and I really want this to be, I would call it a non-blaming, non-shaming conversation, because things change and evolve and adapt to always meet the current social and political environment. So at one time, drug user, substance abuser, addict, and junkie, and I still hear addict and junkie quite a bit in the media, and that can be very stigmatizing, and it is. So let's shift to a language that promotes hope and supports recovery. So these are some of the things that I've come up and used. So I want you to think of your own that promotes hope and supports recovery. So people who use drugs, people with drug use experience, people with experience of drug use, person experiencing problems with drug use. Well, those are some of how I do person-first language, and I think that's really important as a practitioner, as a person going forward, and just living in the community. And I use, you hear the misuses drugs, and what I use is just uses drugs. There's no positive or negative, it's just a fact. So there's also clean or dirty needles and pipes. I use sterile or use syringes or needles and pipes. And I also use a lot of equipment, just in general, because sterile equipment, because harm reduction sites have a variety of full range of equipment, and it's not just syringes that they give. Oh, James has anti-stigma language is so vitally important. It is discouraging to hear drug users characterized by words such as, yep, definitely, and we see that a lot. So thank you very much, James. What are some of the that promotes hope that you see being used? Some of the language, yeah. Some of the language, yeah. Recovering, yeah. Wonderful. And if anyone else has other things, please feel free to just keep typing and we'll just add them to our list. And I can add them to my toolbox of language that I use to promote hope and supports recovery. I think that's so important. Oh, we have Janice typing away. While she's typing, I'm just gonna have a little drink. A little water. So wonderful, yeah. First step, language, right, as we communicate. And I myself, have created huge missteps as I go forward. It's just understanding and then correcting them, and that's fine. And I really love it when friends give me those little reminders. It's because they love me, they give me those little reminders of various things I'm doing and language I use. Janice is still typing. We'll just give her a minute. No stress. We got lots of time, so I'm all good. I just love it that so many people are here and we're all together sharing. I'll come back in a minute. So some of the recommendations, and I told you I would get into policy recommendations for you, and those are actions required at multiple levels. So we always have to have the individual, the community, service provision level, as well as the structural and environmental. I think it's really important, and I know the WHO in their responses really recommended that we focus on all three levels, because we tend to see sometimes it's easier and cheaper to focus on the individual level, but we need to go beyond that. So let's see, the individual recommendations. Oh, Janice came back. Sorry, I'm just going to, is resiliency-based language. How much they're accomplishing and how strong they in spite of their challenges. Oh, that's so right. Resiliency is so important, and strength-based language. Love that. So I'll put that in there. Wonderful. So service and supports on the individual level that take care of immediate needs of the individual. And that's strength-based language could be some of those, right? So this can include individual health promotion and self-management interventions and supports that are available, accessible, and acceptable for people who use drugs. And I put in that the Wellness Recovery Action Planning wrap. They have a specific wrap actually out there for people who use drugs. And so that's pretty amazing. So community and service provision level. And we need to include people who use drugs in all decision-making processes when we're creating services and supports for them. It can't be just for them, it needs to be for and with them. And I really want to focus on that, and that's anti-oppressive as well when we do that. And at this service provision level, I really want to focus on the interventions and supports and services that need to be priority. As we had said, I learned earlier, and a lot of you had mentioned, is that housing supports, harm reduction interventions, income and supported employment, and all of those additional rehabilitation services are so important to focus on, and that's what we need. Just going to go back to James for a moment, and hopefully we can all see this as the anti-stigma language is wonderful. Okay, we must avoid diagnostic overshadowing at all costs. A person first and not a diagnosis. Hoorah, James. Thank you very much. So the structural and environmental and policy level recommendations. And as like I said, and all the way through, we need to have participation of people who use drugs. So instead of for, we need with. They need to be invited to the table when we're creating those laws and policies that affect their lives. And I want to add this, and I didn't add this earlier. However, this is overarching structural. We need to make concrete efforts to address inequities in the social determinants of health for people who use drugs. Income, social status, social support networks, education, employment, working conditions, social environments, physical environments, healthy child development, gender and culture. All of those things are social determinants of health and will determine a person's health. And I actually put in, a lot of folks don't use social and physical environments, but I think it's huge depending on where you live and the laws that are within the environment that you live in can have such an effect. So what did we talk about today? We talked about a lot of stuff and I rambled on, and I appreciate you hung in there with me. So we talked about the barriers for promoting health, social well-being, and quality of life for people who use drugs. We talked about the promoters, the things that make people well. We talked about how PSR and the interventions improve health, social well-being, and quality of life, and how that is definitely in a line. The importance of an anti-oppressive framework, which now I see is understanding to action, and recommendations for policy. I always say, I put this in the little caveat at the end, is think about how can PSR support people who use drugs. Great research project. So next, so I asked you at the beginning, so how can PSR better support people who use drugs? And so I want to thank you for taking the time this morning to listen to me. And some of the examples that I have is making sure that each individual you know, and you've asked them what supports them best, because that's how we're going to go forward. So thank you. I just want to give you this little quote that I've carried around for the last couple of years, and it's human dignity is the most important human right, from which all other rights derive. If we can remember that, we can go forward and treat all people with worth. So thank you. And so just in case we have questions, or if Regina wants to. So thank you, please.
So Regina always has something to say, I know, but just let me begin by saying a big thanks to Cinnamon. I find that very engaging, and I guess just sort of fundamental to how to begin to think about. I must say I'm one of those people who did use, and maybe do use, language like drug use and misuse, and so I understand really I should be saying things like drug use, and I think I'm still struggling with how do I articulate if somebody's really hurting as a result of that, like what kind of language can I use? And so I'm not sure if you have good advice or for me on that, but that's something that I think is still top of mind for me. So I think maybe many of us use drugs on a continuum, but it's really being able to find language that we can just acknowledge if that individual said, well, it's really bothersome to me right now, and maybe there's a way that I could be in relationship with somebody to help them be their best self, whatever that might be, with a harm reduction focus. So I'm not sure if you have some thoughts for me to help me around that.
Wonderful. I think just having a conversation, and I appreciate that, Regina, because I think I struggled even this last year, and making sure that if I am having trouble with language, I go to a person that I know who's a peer who has experience, and ask them what is the best language that I use, and make sure that it's coming from them and not me or an academic or a book, because that's the best that I do, and I try to do that as much as I can.
Mm-hmm.
So yeah. So thank you.
No, I think that's very, very helpful, and I think sometimes we write about it or we think about it, and just finding some language that captures what we're really talking about, while at the same time acknowledging a strength focus, and not to be judgmental about it, but to be able to speak about it in a way that helps us all move forward. So thank you. I was, yeah. And just on the chat, James adds that when it comes to human dignity, we cannot make compromises. Angela Merkel. Wow, all the way from Germany. How about that? James, you are just the quote king. I love how you just have all these things at top of mind. I don't know quite how you do that. You're amazing. So thanks for that. And Janice adds her appreciation as well. I'm not sure if people have questions or comments. I was very curious about the definition of recovery. I'm not sure if that sparked interest with you as well, of being engagement success. I just thought that was a sort of a unique way to look at recovery. Often I think about it with Patricia Deegan's in those kinds of terms as a journey, as a moving forward. But I hear the idea of engagement. I think also that just resonated with me just in terms of the responsibility that, you know, if you are engaged, that means that you're taking care of business in some respects or are moving forward. So I was curious about that. I'm not sure if others had comments as well. Yeah. And then I was wondering if you could maybe tell us a little bit more about some specific options. So when you were talking about different kinds of service options, you talked about Insight and places like that, and you talked about doing some drug testing. I didn't know if you wanted to speak a little bit more about specific things that can, or services or interventions that can be helpful. Maybe expand that conversation a bit. I don't know if we have time for that or.
No, I think that's a really good place to start, because we mostly think of harm reduction as is consumption sites and the overdose prevention sites, as well as, you know, getting sterile, unused drug equipment. However, harm reduction goes beyond that. It's also making sure that all of our services and supports that we offer for people who use drugs, and that's the mental health supports, that's the primary care that we give them, that there's a harm reduction, trauma-informed, and person-centered aspect. And I see all of those three elements together. And that's how I started this project a year ago, but I've really been thinking about it throughout this year, what really makes sense. And what makes sense is we have those philosophies in every service provision that we offer for people who use drugs. And that's including if we have a recreation department and some of our folks use drugs, we want to make sure that they feel comfortable, that we're not excluding them in some way. Mm-hmm. So I think that having all the supports and services, I don't think there's anything one specific, mm-hmm. but I think we need to incorporate some of those ideals within all of our services and supports that we offer. And that will reduce stigma and marginalization. Mm-hmm.
Yeah, I loved your idea about just the primary health care that you mentioned, because I think sometimes people really don't get the physical care they need. And that's hugely problematic, likely because of the marginalization that you spoke so well about. So I think that's one thing, and I think I liked how you expanded as well some of the other rehab services, because I think really helping people gain employment, be able to have a sense of efficacy, a sense of contribution, you know, be it volunteering, employment, being part of family, whatever that might be, but, you know, those bigger services as well that address those determinants of health, I think, vital.
Yeah.
For somebody's journey.
Great, thank you. Yeah, and there's some local organizations that do really help all folks who specifically live downtown, and Pivot Legal Society, and they have the newspaper, and they provide training, and they have the calendar every year, and they provide training for all folks that, you know, want to go through the training, and they don't necessarily have criterion except that you need to be able to maintain the training, and so that's low barrier, and it's very supported. So
what kind of training does that involve? Training?
Well, it has great training. So if you're going to sell newspapers, you definitely need marketing skills.
Cool.
So that's social skills, social interaction skills are really important. And so all of those, you know, skills that we might not necessarily think of, they offer. And so it's a pretty great program.
I didn't know that. That's really great. That's Pivot Legal Society.
Well,
is what I think about, right?
Yes, and then that's their newspaper and their calendar. That's, you know, all of those little side bars. And if anyone else has services and supports, that would be great. So there's some more people that were saying the information and dialogue is so essential to realizing systematic changes that are barriers to recovery.
Excellent session.
Yeah. Okay, all services relative to need and thorough. Oh, and implement trauma and inform practice. Yes.
So that might be the end of the questions and thoughts. Feel free to keep typing if you wish. But I'll just join in that last comment to say excellent session. Thank you so much, Cinnamon. We really benefited from your learning and clearly your experience as well, and all the thinking that goes into a life of, as you were delivering services and thinking about it and thinking about your masters. And so thank you very much for sharing that with us this morning. I really appreciate as well how you wove in the PSR competence and values and how you helped me situate the work that we can do for people, with people who use drugs from that framework. So that was really super helpful for me. So thank you kindly. Wonderful presentation, Jem says. Yes.
So thank you, everyone. I just want to thank everyone again. And if I knew I had this much time left over, I would have really went into the methodology for you earlier.
So we can count ourselves lucky, is that what you're saying? That's wonderful. All right. So if we haven't mentioned it before, you'll know that this presentation goes up on our website, so feel free, you'll be able to find it there on our psyrehab.ca website. Please have a look from emails from Manny and Jen. We may be making some changes to our platform in the next couple of weeks. Please remember, June 1st, we welcome a session around peers, so please stay tuned for that. And also, we have some amazing upcoming sessions as well. Right. Jen says you put the peer support webinar on the website, psyrehab.ca. So if you want more details about the upcoming session in Victoria, you'll find that there on our psyrehab.ca. I'm just going to cut and paste this, so because Jen is kindly copy link location. So I'm just going to put this in the chat box. So if you want to follow up on that, feel free to do so. Thank you. Oh, that went into Jen's chat box, not to everyone. Let me have one more moment. Oh, Jen already done it. She's brilliant. See, as always. Alrighty, super good. Well, let's just leave it right there and say thank you again. Bye-bye, everybody. Have a lovely, lovely long weekend, and we'll see you in 2 weeks. Bye for now.